Hi, my name is Tamayo, and right now I'm going to talk about effects of sitagliptin on cardiovascular outcomes in type 2 diabetes. Definition: sitagliptin, administered orally, prolongs the absence of incretin hormones by preventing their degradation by inhibiting diabetic peptides. This improves glycemic control in patients with type 2 diabetes, mainly by suppressing glucagon levels and increased endogenous insulin secretion.
Sitagliptin is a prescription medication used to treat type 2 diabetes in adults. Sitagliptin is in a class of medications called DPP-4 inhibitors. It works by increasing the amounts of certain natural substances that lower blood sugar when it is high. This medication comes in tablet form and is taken once a day, with or without food. Common side effects include upper respiratory infection, stuffy nose, sore throat, nausea, and diarrhea. For more information on this medication and all other medications, explore the RxWiki Encyclopedia on the web or on your mobile device.
Applications in medicine. The upper limit of the two-side 95% confidence interval of the hazard ratio for the risk of the primary composing cardiovascular outcome didn't exceed 1.30 in the sitagliptin group. Sitagliptin therapy was not associated with change in hospitalization rate for heart failure as suggested in trials of other DPP-4 inhibitors.
We're back at the Boston Convention and Exhibition Center. I'm Rhonda Anderson, reporting from the American Diabetes Association's 75th Scientific Sessions, the largest diabetes meeting in the world. Oral medications can help people with type 2 diabetes reach their blood glucose targets. But there has been a cloud of suspicion over new diabetes drugs and whether they may increase the risk for cardiovascular and other problems. Two research studies presented today at the scientific sessions explore this very question. This is especially important because heart disease and stroke are the #1 causes of death and disability among people with type 2 diabetes. The evaluation of lixisenatide in acute coronary syndrome study, ELIXA for short, is the very first clinical trial to study cardiovascular safety in a GLP-1 receptor agonist, one member of a class of widely prescribed drugs used to lower blood glucose levels in people with type 2 diabetes. These drugs are derived from gut hormones and may be used as a secondary treatment when other medications fail to sufficiently lower blood glucose levels. In the ELIXA study, researchers examined 6,068 people from 49 countries, randomly assigning them to lixisenatide or a placebo, with a follow-up period of more than 2 years. The results? Lixisenatide had a neutral effect on heart failure and other cardiovascular problems. Specifically, the study found no increased risk for cardiovascular death, heart attack, stroke, chest pain, or heart failure in people with type 2 diabetes who had recently experienced heart problems and were therefore at a high risk for more problems. The trial also showed that those who took lixisenatide were not more likely to have problems with low blood glucose than those who took a placebo, despite better blood glucose control. Also, the researchers discovered no increase in pancreatitis or cancers, plus a modest benefit in terms of weight gain. Those taking lixisenatide did not gain weight, while those taking a placebo did. However, the study participants did report higher levels of nausea and vomiting, which are common side effects for GLP-1 receptor agonists. Another study, TICOS, which stands for the Trial Evaluating Cardiovascular Outcomes with SITAGLIPTIN, looked at the impact of adding sitagliptin, a DPP-4 inhibitor, to the diabetes management plan for people with type 2 diabetes and established cardiovascular disease. TICOS followed 14,671 patients for a median of 3 years and found that adding the drug did not affect the patient's risk for major adverse cardiovascular events, hospitalization for heart failure, or other adverse events compared to a placebo. It's also worth noting that the researchers didn't observe significant effects on the pancreas with this therapy, such as acute pancreatitis or pancreatic cancer. With any prescription drug, doctors and patients alike want to be confident that the treatment is worth the benefits, that it doesn't solve one problem only to present another. Thanks to these studies, we can now say that people with type 2 diabetes are safe taking a GLP-1 receptor agonist or sitagliptin to improve their blood glucose levels, even if they are at high risk for heart-related problems. To view this press release online, visit the newsroom section of our website, diabetes.org. The TICOS results will be published online in the New England Journal of Medicine as well. And for the latest coverage of diabetes research and updates from the 75th Scientific Sessions, visit diabetes.org/breaking news, and on social media, use our hashtag 2015ADA.
Pros and cons. Pros. Sitagliptin significantly reduces blood glucose 2 hours postprandial and 24 hours area under the collar, despite the reduction in the prandial and total insulin dose. Several multi-center clinical trials and meta-analyses have shown that pioglitazone reduces cardiovascular events in diabetic patients. PO is a peroxisome proliferase activate receptor and activator that is used to treat type 2 diabetes. Cons. The development of diabetes was the most important CV risk factor compared to other factors such as age, sex, systolic blood pressure, total cholesterol, smoking, and history of CVD.
We are at ESC 16. We are in Rome, and 1 year ago, our CardioSource World News cover story featuring highlights from the London ESC meeting was Great Expectations from Telomeres to TICOS, Causes for Celebration and Despair. Part of the celebration actually was the TICOS part of the story, and the trial that was entitled Evaluating Cardiovascular Outcomes with Sitagliptin was one of the highlights of that year's meeting. And for this cover story update, I'm really going to be standing here with Dr. Sam Engel, who is an Associate Vice President of Merck Clinical Research, Diabetes and Endocrinology. I remember that meeting for very good reason, because the online program afterwards, the highlights, they were a panel of experts and they were expressing great relief because there had been some concern regarding heart failure. And TICOS kind of took care of that. And there was a lot of talk around the panel saying, this is really good news. So can you, before we go to this year's meeting, can we go visit last year's meeting and talk about that?
Sure. So, TICOS was the third cardiovascular outcome study for DPP-4 inhibitors for which the results were available. And, with the first two, there was an indication that there might be an increase in the risk of hospitalization for heart failure. And there was significant concern that this might be a class effect. And so, TICOS, which was the longest duration, really had the longest patient exposure, was being looked to be the arbitrator, if you will. So we were very pleased when we saw that there was absolutely no increase in heart failure or in any composite endpoints that included heart failure. So those data were initially presented at the ADA meeting in 2015, but we did much more in-depth analyses, and those were brought here to ESC. So we were very pleased as well.
Now,
Issues apply in Ecuador. The efficacy and tolerability of the DPT peptidase 4 inhibitor sitagliptin up to outgoing pioglitazone therapy was evaluated in patients with type 2 diabetes and inadequate glycemic control. Significant reductions in fasting serum, pro-insulin levels, and insulin ratio were observed with sitagliptin treatment compared to placebo.
Over the past 2 decades, several studies have highlighted the importance of intensive glucose-lowering therapy, blood pressure control, and statin use to reduce the risk of cardiovascular complications and mortality in patients with diabetes. But the long-term trends of mortality and cardiovascular outcomes of patients with type 1 or type 2 diabetes as compared with the general population are unknown. In a study of patients enrolled between 1998 and 2012 in the Swedish National Diabetes Register, a total of 36,869 patients with type 1 and 457,473 patients with type 2 diabetes were included, along with matched controls from the general population. The outcomes that were assessed were all-cause mortality, fatal coronary heart disease, fatal cardiovascular disease, and hospitalization for cardiovascular disease. The rate of all-cause mortality declined among those with type 1 diabetes by 29%, and in matched controls by 23%, a difference that was not statistically significant. The rate of hospitalization for cardiovascular disease decreased by 36% among those with type 1 diabetes and by 9% among matched controls, a decrease that was significantly greater for the diabetic group. The rate of all-cause mortality decreased by 21% among those with type 2 diabetes and by 31% among matched controls, a statistically significant difference that favored the control group. The rate of hospitalization for cardiovascular disease decreased by 44% among those with type 2 diabetes and by 29% among matched controls, a statistically significant difference that favored those with type 2 diabetes. The authors conclude that mortality and cardiovascular disease have declined for patients with diabetes. For most cardiovascular outcomes studied, event rates have decreased at least as quickly for patients with diabetes as for matched controls. However, as compared with matched controls, patients with type 2 diabetes had a smaller reduction in fatal cardiovascular outcomes. Full study results are available at nejm.org.
In conclusion, there was no significant increase in the rate of severe hypoglycemia among patients in the sitagliptin group compared to the placebo group. Fewer patients in the sitagliptin group required the use of additional anti-hyperglycemic agents or inadequate long-term insulin therapy during the study period. Thank you.